That was a little bit more abstract. I don't know, did I do okay? Was that?
Yeah, that's still really great.
Okay. My name is Brian Turner. I'm from Chicago, Illinois, and I am an active duty medical service corps officer in the United States Army. I think if there was one thing I could change about the industry, it would be the regulation and the bureaucracy. Some of that is good, but I think what those that are not in healthcare, so primarily our leaders, our policy leaders and legislatures don't understand is how simple policy decisions that they see as simple have impacts on patients' lives that are sometimes unintended. And reducing the bureaucracy that's required for providers to deliver care will enable quality to increase in the vast majority of our communities. The hospital no longer is at the center of the healthcare universe, in my opinion. You have a hospital that's a major player, but it's not the central part of the process anymore. So you talk about the continuum of healthcare, and it's bringing people together. How do we keep people out of the hospital? How do we keep them healthy? Once they leave the hospital, how do we prevent them from coming back in? What are our relationships, financial relationships or other types of relationships with post-acute care, with long-term care facilities, with skilled nursing facilities? These are things that healthcare administrators have to consider. We can no longer think of ourselves as isolated in our particular specialty, no matter what that happens to be. I think in the next 10 years we're going to see healthcare become much more cohesive instead of segmented and distributed. I think something that's going to become very, very popular, now it's a buzzword, but we talk about physician leadership and physician executives, how healthcare administrators work with our physician counterparts. Obviously, we have the Affordable Care Act and a new presidential administration and Congress, so we'll see what the changes are that come with that and what it means for patients, for payers, and for providers. With regard to the Affordable Care Act, I don't know that anybody knows what's going to become of it in the next 10 years. What is for sure is that our healthcare landscape will continue to change and to be influenced by external forces to healthcare, whether it be the economy or politics. I think there are always going to be issues that face the healthcare industry. It's in a constant state of reform, a constant state of flux. It's always changing, and in a way that's what I love about it, and that's what is exciting about healthcare. It's never stagnant. I think as long as our leaders and ourselves within the industry always maintain our focus on patients and quality and safety and general process improvement across the organization and ethics, I think that we will be successful in our goal of improving outcomes, containing costs, and improving access.